My name is Nina Brandt-Sandral. I'm based in Mackay, Queensland, Australia. I've worked with Specialised Health since October 2021, so just over two years and a bit. My favourite cohort to work with are really quite complex and multi-dimensional cases. So they might have, musculoskeletal injury that's stopped them from working, and then that's obviously had a flow-on effect to their fatigue levels or their mental health. So we're sort of, dealing with a number of co-conditions at the same time. My most memorable client was recovering from liver cancer. So it obviously had some surgery and treatment there, had been off work for a long period of time. We were brought on because they kept having really sharp pain in the area of the surgery. He wanted to return to heavy machinery driving on a mine site. So it was obviously a general, improve the condition and strength and fitness for work sort of case, but he also had been off work for a fair amount of time, so had absolutely no routine, was, staying up all night and then napping during the day, wasn't eating very well. So to get him back to work, I said, yeah, we need to, obviously work on your condition and your core strength and that sort of thing to help with your movement at work. But we've also got to get you, sleeping at normal times and getting your routine set. He was a very compliant patient. It was wonderful. Took everything on board, and we had a really good result. So he returned to work. And then I heard from him probably 6 months down the track. And yeah, he was in full remission and haven't heard from him since. So I assume he's happy and back at work and enjoying life. At the moment, my favourite podcast and what I'm listening to the most is called Health with Beck or Health by Beck. My favourite exercise to prescribe would be your more stability exercises. So, and things they can do while they're watching TV or at work. So a lot of bracing work, the clams, that sort of thing. So your glute and abdominal activation. Favorite thing from working with Specialised Health is just a variety of work. And I hadn't done much insurance work, and just the variety of cases and the broad range of things that we need to sort of be all over and look up and research and move forward with patients. I think the most important skill that an EP can have is probably rapport and empathy with their patient. Because if you've got those skills, you're always going to get more information, which makes your job a lot easier when you're prescribing and trying to rehabilitate someone. My top tip for wellbeing is to find something that you enjoy. And if you're not enjoying it, keep trying something else until you find your thing. There's lots of stuff out there, and what we prescribe or what we suggest to you might not work if it's something that you don't like.